The process of change is confronting. Where am I going? During this process of transitioning, it's not just a bodily change, it's a mental change as well. And what I mean by mental change, not just my moods or whatever. It's about how how do I put this? It's about relating to the world in a different kind of way, or relating to other people in a different kind of way. I mean, I am who I am, I know who I am, and all of that stuff. No, I really wish I was born. I mean, I don't want to be, leaving aside the whole antinatalist thing. I mean, I just wish I was a girl, you know? I don't know how to explain that to someone. Why would I have the desire to be a girl? And where does it come from? Why am I putting myself through all of these steps in order to transition? I mean, transitioning is not easy. It's hard work. There are social consequences and all of that. It's not something. I mean, why would I do that? I don't. But I do have this desire to, I don't know, be a girl, be myself. And part of being myself is being being girly. I don't know. I just can't articulate what I'm trying to think. I don't even know what I'm trying to say. It's just like I hate being a man. I really don't like it. I just don't like the social gender role of man and masculinity. I just don't fit that role. I guess that's one of the reasons I wanted to transition, is because I feel like I fit more in the feminine role, I don't think. Some people say gender is purely a social construct. I don't think it's purely social. I think, a lot of it is cultural, But there is a difference between masculinity and femininity, and I don't know where. Maybe the difference begins in our brains, in our biology, the hormones. Maybe even our brains, the female brain, the male brain is wired slightly differently. And they say the female brain is more verbal, skilled. Evolutionary reasons, I suppose. But there's also this thing called the female. People don't like using the term essence. Male essence, female essence. They don't like essentialism. It's frowned upon, universities or something. But you know, yes, people are individuals, but there is this broad. I do believe there is this broad thing of masculinity and femininity, maleness, females. I do think there are broad. These two broad categories do exist, and people, yes, fall along a continuum. You know, some people are more masculine, you know, usually men, and some are, you know, feminine, whatever you want to put in there. We can sort of argue about what should we put as defining female, but you know, we can agree upon some commonalities or whatever. So you know, people fall along a spectrum, and you know, to me, it's like. You know, I just find the masculine role very. Nah, I don't like it. I just don't like it. It doesn't mean I am hyper feminine or anything. You know, there is this hyper femininity, which you know, I don't think I'm that. I'm more. You know, I feel like I'm sometimes I feel like I'm stuck between masculine and feminine. You know, sometimes I feel like, what the fuck? You know, I don't even fit into boy. Either of these categories don't make sense to me, or I just don't fit into either of them. So you know, I mean. But if I were not to analyze myself, if I were to just, you know, right now I'm doing this introspection analysis. If I were to just sit in the mirror, and if I just got up and looked at myself, I mean, sit here, and if I just got up, in my subconscious, there is this perception of, or this self-perception of femaleness. So, for instance, without thinking, you know, I can see myself internally as, you know, as a woman or whatever, wearing female clothes, or dress hair or whatever. Then you know, nowadays I tend to, my breasts, for instance, I want, like, you know, I'm just like, you know, very eager for them to develop, and you know, it's like, so the best way I can describe it is, in the subconscious mind, I have this self-perception of femininity, womanhood, all of that. That's as basic as I can say it. I don't know why it's there. I don't know. I don't know. You know, if I start consciously trying to analyze it, like, right, if I like take, you know, I can't really articulate why this internal self-perception exists. I don't know why it exists. Maybe it's something to do with, you know, maybe in the womb, hormonal stuff happening, or it could be my childhood, the way I grew up, you know, with my parents being, you know, my dad or whatever. So I don't know exactly. I mean, I've always, I mean, I can't. To me, I don't know when I started having this self-perception of, you know, I would have this internal, like, without thinking about it, every now and then, you know, it just happens, like, internally, this is how I would see myself. And I didn't think there was anything wrong with it, you know, I wouldn't think there was anything wrong with me, you know, wearing skirt, or, like, I never actually did it in practice, but in my mind, I would see myself wearing a skirt and a blouse, and, you know, usually in an office secretary type thing. I don't know why. I mean, I don't think there was anything necessarily sexual about it. It was more like a very traditional, demure kind of look, and I liked it. I don't know. It's just like. it's hard to explain why I feel the way I do. Well, it's hard to explain why I feel like a girl or see myself as a girl. I can't. It's hard to consciously state it, but it's more like it's like a reflection or a reaction or like a reflex mechanism. Like my self perception is like that. It's, you know, I think I would be really happy being a girl. That's one of the reasons why I want to transition. Is I want to be happy with myself. I don't want to have this conflict between what I feel and what my body is and how my society sees me. It's just that it's kind of. I only have one life. And if I'm going to live this life, I might as well live it in the way I want to live it. I might as well live it in the gender I feel like I should be in. I know some people, they consider they don't like this binary between male and female. I mean, for me, I don't have any problems with the binary. I do believe people fall in a continuum, but I do believe there are these broad categories of masculine and feminine. And for me, I want to belong in the feminine. I mean, I want to be. Yeah, I want to be socially accepted as being in the feminine. You see, because I can see myself however I want to see myself. No one else has to validate how I feel about myself. And that's how the way I feel about myself is the way I feel about myself. That's just that. But what I want is actually social acceptance of being in the female category. That's why I'm trying to transition, because I just don't want to be in the social role of a man or whatever. I don't like it. I just don't fit that role at all, and it just doesn't suit me. Oh yeah, and regarding this whole penis thing or whatever, I mean, I really, I don't want to hate my penis, but it does like, let me put it this way. Society will be more accepting of me as a woman if I don't have a penis. But if I have a penis, society is going to be like, oh, well, you still have a penis. Because that's how we judge people. We judge people on their genitalia. We say, oh, if you have a penis, you're a man. If you have a vagina and breast, you're a woman. That's how we say, oh, gender is related to sex. Where I'm saying, no. Yes, sex is there. And usually people who have penises are masculine or identify as male. But some people who have penises don't want to identify as a male. They don't feel comfortable in that. And so even if I might not have any problems with my penis, I think the problem may arise because society will still, or some people will, maybe the majority of society will still say, oh, you are still a man because you have a penis. Whereas it's like, no, it's just my penis. It doesn't. It's just a thing. It doesn't. My gender is something else. It's a mental thing. It's also a mode of presentation, I suppose. It's just it starts in your head, but gender is also you're presenting in a certain way. So that's how I feel. I feel like sometimes I feel like, oh, I should get a surgery because then it'll also like help me also feel a little bit more confident, because if I don't have a penis and I don't have anything to like talk about, I wouldn't have any issues that would come about by having a penis and presenting as female. then there are these people who are called trans women or transgender women. Majority of them don't get surgeries because surgeries are expensive. They're very risky. So and I think doctors. I heard somewhere that doctors don't encourage you to have that because it is kind of risky, and yeah, and so I'm like, kind of conflicted whether I should get surgery or not. Sometimes I want to because I can just sort of get it over and done with. I don't have to think about it. And other times I'm like, why, do I really want to do it? I mean, is it really that important? Another thing is like, I really don't have much of a sex drive these days, which is good because, fuck, it's, when I was kind of depressed anyway, so I wasn't really that sexually whatever, but yeah, taking these estrogens and blockers, I think they call it chemical castration because it sort of diminishes your testosterone count and all that. How do I feel about that? It's a weird feeling because it's like losing something you've lived with for a long time. It's like how, let's say you had something, you didn't really think about it much. It wasn't the most important thing, but it was just a part of you. And one day it sort of goes away, and the feeling is like, it's sort of a sense of a loss. It's like, oh, I'm losing, that male part is sort of going away. It is a sense of loss. So, well, it's not like I'm horrified or I'm so sad about it. It's just more like, imagine if you had something with you for a long time and suddenly what you had sort of, it's like something that's familiar and it's a part of you, and then it just sort of goes away. It's like you'd be like, oh yeah, it's sort of gone, or it's going away. It's like, yeah, it's bye bye penis. Bye bye little guy. You're getting littler and littler. So yeah, it's kind of like that. It's like yeah. So yeah. I know some transgender women. They're like, I hate my penis. Oh, I just hate. I want to just get rid of it. I'm not like that. Yeah, there are other transgender women like me too who they don't really hate their penises. I mean, some of them actually. Like I was seeing that show that they actually like their penis. So it's like not every trans woman hates their penis. That's a myth. And most transgender women don't have surgery, so this idea that we hate our penises is just some stupid, like a myth, I think, promoted by this, So yeah, anyway, so I feel like there's a social pressure for me to get surgery, but personally, I just don't feel like I need to get it. But ideally, I mean, if I had the choice where I could just press a button and I wouldn't have a penis and I would have a, cosmetic vagina or whatever, because I don't think I want to have a real vagina because that brings the risks of pregnancy and all of that. But a cosmetic vagina, because that's what you get. You get a cosmetic vagina. I think, and if there weren't any risks involved in it, it's just a simple procedure. Yeah, I would press that button. Why not? It's very, I would rather not have to worry about this whole penis thing. It's like, it'll be much easier for me to just, oh look, I don't have a penis now. Okay, all right, and I'm a woman. I don't have a penis. Just, it's like people are like, so caught up with this genital thing. But in a way, if you're a woman, there's the real risk of getting pregnant. So that is that's a serious problem there. So I don't want to minimize that. I mean, getting pregnant, yeah, that's a serious problem there. So, yeah. But, just talking as from this transgender perspective, yeah, I don't really hate my penis, but if I had a choice, yeah, I would prefer not to have it. I mean, I wish I never had it. I wish I transitioned earlier or whatever. But right now, I'm like, flip a coin. Get the surgery, don't get the surgery. It's an option that I'm keeping open. I'll keep it open for now. I haven't decided one way or the other, but it's an option now I'm going to keep open about the surgery thing. Anyway, just talking about some of this stuff and such.